My name is Patricia Bolton. I'm a pediatric nurse practitioner. I work at Hudson River Healthcare in Armenia. I'm going to talk today about the HPV vaccine. HPV stands for human papillomavirus. In women, it can cause cancer of the cervix, which is the bottom of the uterus. It is spread by sexual activity. It's a very common infection. 80% of people in the United States will develop an HPV infection in their lifetime. For most people, the HPV infection can clear on its own, but in some people, the infection will go on to cause cancer. Every year in the United States, HPV can cause about 32,500 cases of cancer. There is a vaccine that can protect against this type of cancer. It protects against about 30,000 cases of cancer in the United States every year. It prevents, even though you had exposed to the infection, it prevents you from developing the disease or the cancer. It can prevent about 70% of cervical cancer. The vaccine is not new. It's been in the United States since 2006. There was a new updated and improved vaccine that started in 2014. This vaccine protects you against cancer, and it also protects against warts that can be spread by sexual activity. It can be administered to young women through the age of 26 and young men through the age of 21. However, the vaccine is more effective when given to younger people. It's more effective. It can be given. It's generally recommended starting at age 11, but it can be given as young as age 9. If you start the vaccine when the kids are young, you only need to have 2 doses because the vaccine is more effective. So if you start the vaccine at 11, it would be recommended that your child come back 6 months later to get a second dose of the vaccine, and then they're done. If the vaccine is not started until after age 15, 3 doses are needed because the vaccine doesn't work quite as well, and 3 doses are needed to get full effectiveness of the vaccine. So in that case, your child would get 1, they would come back a month or 2 later to get the second dose, and then 6 months after the first dose, they can get the 3rd dose, and then they will be done. In women, even though this vaccine is highly protective against cervical cancer, it would still be recommended once the girls get older than 21 that they still get the pap test or the testing for cervical cancer. Any vaccine or medicine that we take in our bodies can possibly cause side effects. The most common side effect of the HPV vaccine is soreness of the arm. The kids will complain that their arm hurts probably for a day or so after the vaccine. If they apply something warm to their arm, or for example just take a nice warm shower and move their arm around, that pain will go away within a day. The HPV vaccine has been sometimes found to cause kids can get a little bit nervous when they get the vaccine, and they can faint. That can actually happen for teenagers with pretty much any vaccine. But whenever the HPV vaccine is given, it's recommended that kids wait for 15 minutes just to make sure that they feel well before they leave the clinic. Overall, the HPV vaccine has a very good safety record. Other mild problems that can occur following vaccination are fever, headache, and other body aches, which are similar side effects to those found with other vaccinations also. HPV, the primary reason it's given is because it protects against cancer. So it's really a cancer vaccine. In women, I guess the most common place affected in a woman's body would be her cervical area, which is the bottom of your uterus. When a woman starts getting their cervical testing through their gynecologist, it used to be called a pap test, and now they just call it cervical screening. That test is to check for cervical cancer. The vaccine is highly protective against this kind of cervical cancer. Initially, if a woman had cervical cancer, they wouldn't know. That's why routine screening is recommended for that in women over the age of 21. They should go every year or two to their gynecologist to get the testing. If a woman went on for years without testing so that the cancer was not picked up, she might possibly start having problems like a lot of bleeding or pain in that area. It's highly recommended by numerous medical and scientific agencies, including the Center for Disease Control, the American Academy of Pediatrics, and the American Academy of Family Physicians. I would highly recommend that you consider getting your child vaccinated against HPV, or human papillomavirus. This vaccine could save their life. Thank you.